Okay, so welcome. Today we have a very strange scar on a very lovely lady. She is here because the scar has been there for a long time and there's no good solution to it. It started spontaneously and just went downhill, and we don't know why. I'm going to let her tell you the story herself, and it's been a struggle trying to come up with a great plan, but I think we do have a plan. Let's talk to her and see what she thinks.
So I got this scar I would say about 3 years ago now. It started with about 3 almost little bumps on my forehead. Didn't really know what it was. I have some skin issues, so I kind of left it untreated until it started to become pus filled, and then it started to become even like a big round dot like that. So I went to Emerge in my hometown in Canada. They gave me some antibiotics. They weren't really sure if it was shingles or dermatitis, so they treated me for both. Went on IV antibiotics for about 5 days because the infection swelled up my face. When it was healing, it opened up. As you can see, that's basically the way that the scar was completely a scab, and it never really healed properly. So the scar that you see, that was all scab, so the incision almost opened to drain the pus, and then I guess it never really healed, I guess, as a normal scar would, so I'm left with a crater in my face. But yeah, they didn't know what it was. They still to this day don't know what actually caused it. I saw a plastic surgeon in my hometown, but he was also unsure, so that's why I'm here today.
Fantastic. So now we move on to the hardest part, which is going to be drawing and trying to figure out the plan. So let's get started. So as you saw the story from our lovely lady, I think she got shingles. That's my suspicion, which is herpes zoster. And what happened after that is an infection, bacterial infection, and then the scar. So it is very important that we use Valtrex, which is Cyclovir, an antiviral, and we have started her on that already. We are using antibiotics as well, and hoping that it doesn't flare up. I don't think it will, with all the proper precaution that we have taken. And let's get started. And she's so sweet, she's letting us videotape, which is so unusual. Everybody wants to be in Genjua Witness Protection Program, even me. You never know what I'm hiding from. Okay, let's start. Okay, so let's take a look at the drawing, which is the most critical part. We have many different options. One is straight elliptical, and second is doing the W-plasty. Third is the multiple Z-plasty, which are pretty much the same directions, or geometric broken line. There's a fifth option that I recently learned called small wave closure. I'm not doing it today for reasons I can't get into, but let me show you what I'm doing with the geometric broken line closure, and then after this I'll get the patient's approval and then get started. So let's take a look. Okay, so the goal is to make sure that we minimize loss of normal skin. So I try to make good use of the actual atrophic scar. So I'm trying to stay within the boundaries of that and minimize loss of any extra skin. So you can see, if you look within the boundaries, there's really very little normal skin, like right here maybe a tiny bit, right here a tiny bit, but that's about it. So this is the beauty of the geometric broken line closure. You can adapt to the needs and minimize loss of normal skin, and yet get a nice little closure. So that's the plan, and as you can see, looks pretty good right now. So let's show it to our lovely lady. Yes, all done. So very excited, went beautiful. For the younger surgeons, actually for all surgeons, when you're doing it, and applies to me as well, we have to be so careful to make sure we can match the jigsaw puzzle really well, because once you make the cuts, then you're done. And in that case, if it happens, just remember the answer is undermining, so you can take the tension off. And second is, wherever you end up looking like, oh my boy, there's a dog ear, just take a Burroughs triangle out. Don't be afraid, try to minimize it, but make sure this is all flat at the end. So let's take a look now. I want you to see. So this is the final result right here. So right now you can't even tell, but it's going to be like this, and then this, and then this. and that's going to blend in very nicely, very nicely. And now we are going to apply some steri strips, and along with that inject a little bit of Dysport or Botox right here, not too much, and then we are good to go.